Wound healing myths. There are some well-known myths when it comes to wound care. Superficial damage to the skin, like cuts on the hands, fingers, and knees, are the most common injuries. No matter how small an injury may be, all wounds need to be treated with care. It is always better to seek medical advice to prevent wound complications or mishandling treatments than listening to popular folklore regarding wounds. Number 1. Superficial wounds are less painful than other injuries. Superficial wounds, such as abrasions and burns, are often more painful than deep wounds due to the large number of nerve fibers located in the epidermis, the topmost layer of our skin. An injury that causes a wound to bleed profusely should be looked at by a doctor to give it the proper treatment. Number 2. Wound healing should not cause itching. On the contrary, the affected area on superficial wounds should begin itching a few days after the injury occurs. Itching actually shows that the healing process is going well, because what is happening is that cells are uniting, contracting, and pulling towards each other to shut the wound. This healing process activates the familiar stinging sensation on the skin, though it can also be experienced on deeper wounds. However, be careful if the itching becomes constant and turns into a throbbing sensation. If redness appears around the wounded skin, or if your wound starts to drain yellow or greenish pus, contact your doctor, because those are signs that the injury is infected and antibiotic treatment may be needed. Number 3. Slow healing can be a severe disease indicator. Sluggish wound healing can be an issue, but it will also depend on the severity of the wound and the individual's health condition. Wounds should generally be healed within a few weeks. If it is taking longer, have it examined by a healthcare professional. In most cases, slow wound healing may be a sign of blood circulation problems, immunological issues, or in some cases, it might be a symptom of a disease such as diabetes. Number 4. Wounds heal better when exposed to air. This has always been an extremely popular myth. The truth is that wounds do not heal better when exposed to air. The top priority in proper wound care is to keep wounds free of germs so that dirt and bacteria won't penetrate it, avoiding any risk of infection. Keep the wound or injured area as protected as possible with an adhesive bandage. Nowadays, there are excellent choices for sticky bandages such as waterproof and 100% latex-free options that can seal the wound from dirt and contamination while safeguarding you against allergic reactions. Removing a bandage to let it breathe only exposes the injury or wound to bacteria and contamination. Before applying any bandages on the wound, the most important thing to do is clean the area with alcohol-free disinfectant, which is better suited for sensitive skin so it doesn't hurt. It will heal completely with no complications when covered with a bandage. Number 5. Small wounds don't require treatment. No matter how small an injury or a wound may be, proper care is mandatory to help prevent infection. Any wounded area should be appropriately cleaned, disinfected, and covered. Even the smallest cut made by a sharp object like a pin or a needle is an entry door into our body, a potential place for germs and bacteria to invade. The bottom line is that providing proper wound care will ensure optimal healing no matter the size of the wound. Keep the wound dressed after having cleaned and disinfected the area, because that will also protect the injury from further harm and becoming a gateway for undesired microbial dissemination. Always have a first aid kit handy with alcohol-free disinfectants and different sized bandages ready in case you need them.